No, you're good. Okay. Imagine spending $3 million every day since Jesus was born. Even if you had, you still wouldn't have spent the amount of money the United States did on healthcare in 2014. Catherine Wilson reported in May of 2016 for the California Healthcare Foundation that it is estimated that the U.S. spent around $3 trillion in healthcare costs in 2014. Morgan Tooley, a senior nursing student at the University of Nebraska Medical Center, states that this overspending in our healthcare system is something that she frequently sees at her job as a certified nursing assistant and at school. Our current healthcare system is set up by business people and politicians, many of whom have spent little to no time in healthcare and hospital settings. Because of this, it severely harms patients and doctors alike. Today I will discuss how our system is set up, why it is harmful, and what we should do to improve it. It is important that we put these choices back into the hands of the people who will be most affected by it, the doctors and people like you and I who will now have to pay a fee if we do not have health insurance. These decisions will not only affect every single American's finances, but their ability to lead a healthy and fulfilling life. The structure of the healthcare in the United States is different from most other countries in the way that it isn't covered by a single-payer system. In a single-payer system, government, non-insurance companies, cover the costs associated with healthcare. The lack of a single-payer system in the United States causes the prices of most health-related items, such as prescription drugs, to be higher than in normal countries. This is because the government has the power to negotiate their prices in single-payer healthcare systems. This gives people little to no options about the brands of their drugs and other medical supplies, but they're significantly cheaper because there's only one available to them. But this is not the only reason healthcare is more expensive in the United States. David Cutler gave an interview for PBS News in November of 2013 about the costs he states associated with administration, which is 4 times higher than any other country. This is mainly due to the multiple forms that insurance companies require to cover costs which many people have to manage. Lita Epson for Investopedia in August 2015 also states that the reasons for costs being so high is the high cost of defensive medicine in the United States. Defensive medicine is the practices doctors take in order to avoid malpractice lawsuits. Often, doctors will order CT scans or MRIs to make sure they didn't miss anything in fear of getting sued by their patients. This can be seen in the area of antibiotics, as well as many doctors have prescribed antibiotics in years just in case, which leads to not only higher costs, but also the rise of more antibiotic-resistant bacteria. Insurance companies work to cover these high costs of healthcare by charging a monthly fee for service. Then the individual with health insurance for a certain amount each month, is responsible for a certain amount each year called a deductible, and the health insurance company pays for the rest. This helps those who have health insurance pay only a small fraction of what their total healthcare bill is. But Anna Marie Barry Jester and Ben Castleman reported in September of 2013 for 538.com that around 33 million Americans still do not have health insurance, mainly due to the high extra monthly expense. There are options for the elderly and poor to still get health insurance through government-run programs called Medicare and Medicaid. Medicare covers the elderly over the age of 65, and according to their website, Medicaid.gov, Medicaid covers those under 65 who are at or below the 133% poverty line. Medicare and Medicaid are very similarly set up to the single-payer healthcare system that most other countries have. If one does not qualify for Medicare or Medicaid and does not have insurance, they will often be responsible for the tens of thousands of dollars in medical expenses if an emergency were to occur. These uninsured individuals are the ones who suffer most. Not only are they a part of a flawed system, like everyone else, but they are also responsible for the enormous debt that follows. But it is not just the uninsured who suffer from the American healthcare system. All patients and doctors also suffer as well. Doctors are spending less time with their patients, which decreases the physician-patient bond, which in turn results in patients not getting adequate care. Most doctors go into the field of medicine because they believe that they will be helping people and saving lives. While this may be the case some of the time, Sandeep Shah reports for the Wall Street Journal in 2014 that only 6% of doctors described their morale as positive and stated that they wish they had more time with their patients. This is often due to a fee-for-service model in which hospitals run under, in which they are only paid for by the services they charge. This often leads to doctors having to see many patients a day, often a new patient every 15 to 11 minutes. This causes extreme waste of overprescriptions and testing. One doctor said in the article, "Being aware of all the wastefulness, it all really sucks the love out of what you do. I feel like a pawn in a money-making game for hospital administrators. There are so many other ways I could have made my living and been more fulfilled. The sad part is we chose medicine because we feel like it was worthwhile and noble. But from what I have seen in my short career, it is a charade. More importantly, this harms patients. People no longer have a family doctor who knows and listens to them. Instead, they go to multiple specialists who see hundreds of patients a week. This leads to unhappy patients who struggle to find someone to take care of their case and fight for them for their right to good health. Not only are these victims of a healthcare system in huge debt due to high medical expenses, but they are often unhappy and often still sick, the one thing that the system was supposed to fix in the first place. In order to truly accomplish what the healthcare system is supposed to do, get and keep people healthy, there needs to be changes. We must come up with a solution to fix our healthcare system before it continues down the same destructive path it is on right now. In 2009, a new healthcare reform law was passed called the Affordable Health Care Act, or Obamacare. While the goal was to make sure every American had health insurance, it still has not fully accomplished this. On June 22nd of this year, Republicans unveiled their plan to reform healthcare. Their goals are to repeal Obamacare and to put a new plan into action. The title of the plan is A Better Way, but it still fails to correct the destructive system we have here in the United States. While Obamacare has been somewhat of a disaster, it is important that we move forward, not backwards in our goal of making America healthier. Today I have shown you how the American healthcare system works, why it is failing us, and some plans proposed by politicians to help fix the problem. But there is hope. We live in a society where we get to choose the leaders who make these tough decisions. I encourage you all to become educated with your local leaders, motivate them to care about the system and to take action for it. Vote for those who want to improve healthcare and have new ideas to bring to the table. At the end of the day, we only get one life, and it is absolutely crucial that we have a system in which we are able to lead a happy and healthy life.